Welcome to the Hanley Effect, a podcast by the Hanley Foundation designed to educate, change minds, and save lives. Our goal is to inspire you, showcase our innovations, and change the conversation about addiction and mental health. Join us as we unravel stories of resilience, recovery, and hope.
Hey everybody, welcome to the Hanley Effect podcast. I'm here with Dr. Rachel Docekal. Hey Rachel, how are you?
Hello, Dr. D.
And I'm John Dyben, and we are here with our special guest today. Dr. D, you want to talk about our special guest?
I would also like to say that I'm glad that I get to, because our electric just went off a minute ago, and we thought that maybe Meghan had made the drive for nothing. So Meghan Brooks, who I always say is filled with piss and vinegar, the very best vice president of revenue management ever. Welcome.
Thank you both. I'm very happy to be here. Working at Hanley is very near and dear to my heart. What was not mentioned is I'm also an alumni of Hanley Center, and we've had some people on campus recently, so I've been able to tell my story, a few times in the last couple of days. And
it's the best story
ever.
It's
been wonderful to say. I've only been to Hanley Center as a patient, and I've only worked at Hanley Center as far as a treatment center. And I'm so to say it's near and dear to my heart is an understatement.
How comfortable would you be telling us some of that story?
Well, I can go way back to, I actually did not, I bounced around the country quite a bit. I'm not from South Florida. And I wound up here not to go to treatment, which is everyone's assumption, right? Because everyone kind of makes their way down to South Florida at some point for treatment. And that was not my story. I came here to continue partying, late into my 20s when it was just not cute anymore. And it was like, ma'am, you need to go home.
Yeah. Was your picture on the back of bars across of
I've been
Florida?
Kicked out of a few places.
With a big circle and a line through it.
Do not serve this woman. So, I was naturally complaining to my therapist, a wonderful woman down in Boca. I don't see her anymore, but she was amazing in my journey and explaining, why my life was a disaster and all of these pieces. And she, one day after knowing me for a little while, was like, do you want to talk about like your drinking and drug addiction? I was like, that's not it. If you could just fix all these things, that would be great. And so I came around, and I would slowly go to, truthfully, all on the table, I would go to NA meetings because I was like, okay, these are my problems. I'm an overthinker, I'm a control freak, so I was going to outthink alcoholism and addiction.
Great.
I was like, there's got to be a way, and I'm going to find it, and I'm going to be a millionaire. So I would go to NA meetings because I was willing to give up X, Y, and Z prescriptions or street drugs, but alcohol, it was unfathomable. The idea of living without alcohol. Truly, it was like, I remember she looked at me and said, imagine what your life would look like if you just didn't drink. And I truly paused for a second, and I said, well, what would you bring over to people's houses? What would you do at the beach? What would you do at the pool? I went on for probably 5 minutes. Wow. And she said, that's why you need to stop drinking. I couldn't see a life without it. And so I went to NA, and I would conveniently come in late, leave early, and which is not recommended. And
thanks for the clarification. Good, yeah.
Should probably be there the whole time, maybe a little after and before. And so I would do that. And when I finally one time showed up on time, and in the beginning of that particular NA meeting, they mentioned that alcohol is a drug. And I was like, well, not for me either. So
you left really early that day.
Yeah. Yes. So things eventually, no surprise, continued to get worse. And I was open to the idea of treatment. And she gave me a few options. And naturally, I went to interview these places and, see what they had to offer me.
Right.
So I remember touring Hanley. And it was beautiful. I mean, I had no plans on admitting that day, which now working in the admission side of things is hysterical. I've been with Hanley for 8 years, and my favorites are the local drive-ins who will be there at noon. I'll be there at 2. Oh, I got a lot to get dialed in before I come to treatment. I'll be there at 5, 7, and midnight rolls around, and they're pulling into our parking lot. So also not recommended. But anyway, I toured, and I eventually admitted, and it was amazing. I mean, I did stay 30 days. I was recommended to do longer. I still self-will run amok. I was like, I've got this. I've paid you, and if you did your job properly, I'll be healed. So
check that off.
Yes. I had the insight to continue on in lower level of care. I did IOP because, again, I lived locally. I didn't go on to sober living. I didn't do any of that. Again, recommendations. And naturally, I didn't stay sober. I drank and tried to control it. I would come to group and complain about how, the job was not done properly. And, they would listen to me and let me go on. And one day I showed up. I had been out, I'll never forget, a club in Miami, and I couldn't get drunk. I couldn't get high. I was miserable because it was no longer the solution. It was like I was in that in-between of like, it worked for so long and it's not working. What do I do? I had literally no other coping skills since I'm 13 to that day. And went ahead and went to IOP. I was like, told my story. And they suggested I check into inpatient. Again, I was like, no, that's not appropriate. You don't know what you're talking about. And I was kicked out of IOP. They're like, we can no longer help. We can't co-sign this,
That's
right? And
That's
you're
right.
disruptive to the other patients.
Right.
You keep showing up high. It's concerning.
It's a problem.
It's frowned upon,
Yes.
to say the least.
Goodbye.
Yeah.
Goodbye.
And that's my sobriety date, June 16th, 2010.
Wow.
Because I think the first 30 days were on spite alone. I mean, I was like, I'll show them. But Hanley taught me just enough to ruin my drinking, truthfully, but also gave me the tools of smaller meetings, women's meetings. Do not come late. Do not leave early. Talk to people who have something you want. My first sponsor, she shared in a meeting once about getting Botox. And I was like 28 or 29 at the time. I'm like, one day I'm going to want Botox. She's my girl. And that didn't, I swear, I can't make this up. And that's how I chose my sponsor. And that didn't work out. But yeah. So that was my story.
So one of the things that we know is that a lot of times our patients come in, people with substance use disorders tend to be the smartest people in the room. Smartest
Absolutely.
people in the room.
Absolutely.
You are absolutely one
Without
of
a
the
doubt.
smartest, if not the smartest person in the room.
No question.
All the time.
Thank you.
So I love the 13 to 15 years of outthinking drinking.
Yeah.
Great.
I got this. I thought I was going to write a book. So yeah.
You still might, just a little bit different.
It's going to be a different
Yeah.
narrative for
Right.
sure.
Right.
For sure. So I understand, and the people on my team really understand the importance of that first phone call. And, at Hanley, we really are able to work with an individual and meet them where they are. I always say I've learned the most about treatment centers, not Hanley, in interviews. So interviewing people to come on to admissions or come into Hanley and hearing the stories, I'm like, wait, they did what? I mean, there are stories of if you don't get the insurance information within 3 minutes, they'll hang up on you because there's some quota about length of initial phone call. And because that's when you have to pay for it or something on the marketing side. And I was like, what? You do what to someone asking for help? Are you out of your mind?
So
This is healthcare.
talk to us a little bit more about specifically what is it that you do? What does your team do?
Sure.
And how is that different from, you're talking about some of the differences, but tell us a little bit about your team and what you manage.
Absolutely. So I run the admissions team, and, you're going to call and get a human that is not routing your call somewhere. My entire team is on Hanley campus. We are at the resource center. We go and greet our patients when they arrive, because we might have been talking to them or their family members for 2 hours, in a fast moving case, or 2 months, 6 months, something along those lines. So that connection is so important. Critical. To be able to build the trust and really listen to an individual's story or listen to a family member's story on the front end. And, that's vital to me. I just got a call back from a woman the other day who I hadn't spoken to in 6 months, but she saved my number because I probably spent 45 minutes on the phone with her, and I'm happy to do so. I don't feel rushed or I have to, and that's the beautiful piece, is we are an organization that I truly just want to help that person. They might never come to us. They might never have their loved one come to us, and that's okay. I want them to get help because I know what addiction feels like.
And it's real information. I mean, truly, they're more like patient advocates because they are answering questions and there are no lies. There's no, you can get sober in 7 days or 10 days.
Right.
Yeah, exactly. No.
Yeah,
and
absolutely.
But that's out,
It's
out there. Yeah.
It is, very much so.
It's out there. Everything Hanley does, as you know, is research-based. Well, you're our chief research officer. So they draw on that research to answer those questions.
Yeah.
They draw on SAMHSA's research to answer those questions.
Yeah. The longer episodes of care, the continuum of care, the step down, the communication between, if there's a treating physician or therapist pre-admission, getting that history. Someone lands in treatment is not going to be, a good historian always, let's be honest, and working with their loved ones, whoever they may be. It may be a really close neighbor who is their emergency contact. They might have, pushed everyone else in their life away. Getting communication with that person. We send out sometimes a family, like a history timeline, to family members. And I encourage them, send it to whomever. If there's a stepsister, aunt, uncle, almost like an intervention letter, right? Where it's just a breakdown of, this is what we've seen in Johnny. This is where we really think, because getting those little nuggets from all parties paints the picture of who he is.
That's right. And this is healthcare.
Yeah.
I mean, you chase after medical records, for example. We have
Right.
people in treatment who are in liver failure. We have people in treatment who, you took a patient through the process that was in active chemotherapy about 6 months ago, 8 months ago.
Absolutely.
I mean, so our medical department can deal with those cases, but it's critical to get that background.
100%. And we're able to treat the cases that a lot of places, two scenarios, can't and turn away, or unfortunately, which I've seen, and we get those calls, day one, they say, sure, come on in, and it's way above their scope,
Right.
Which is just heartbreaking. But as an addict, I can't imagine, or alcoholic, to be told by a treatment center, you're too sick to come here. What that would do to you, like spiritually and emotionally. It just has, it gives me chills. It's dangerous to tell that person they're too sick, or we can't figure something out for you, or we can't help you get somewhere you need to be, because what is that? They're just gonna say, forget it. I tried, I made the call and it's not working.
Right. And that can sometimes be the worst. People think, any attempt is good, but sometimes when things go south, that it just contributes to that sense of hopelessness. And I've already tried it, so nothing's going to work. I was thinking about that word admissions, and I think about healthcare admissions. And I think about going to the hospital when my wife was having one of our kids or something like that. And admissions is this very separate kind of, you go and you talk to this person and they put things in the computer, and I don't think they ever move from that little spot. But your process and your team's process is really wildly different, and it's really integrated. And I think I'd love to hear more about it, because the point of even having those contacts with, treating physicians and people, addiction is a chronic illness, but we still treat it like an acute episode of care.
Sure.
And your team and your model that you have in place, begins this process where there's truly continuity of care even after patients are long gone. So how does like an admissions team have such an impact in the actual treatment?
Sure. I'd love to speak to that. It's, when someone calls in, again, they're not routed through a system. It's all local. We're right here. We're happy to do a tour. I love when local families want to do a tour. But back to the phone call, you're going to speak to the same person, whether it be myself,
I love that.
Ashley, Brad. You're going to call in and get that person. You're going to have their direct office number, not the call center room number, right? You're going to be provided with a direct number to their office, their email address. There's going to be that constant communication. And I always encourage, if there's any other family member that wants to reach out, especially if they've had a bad episode in care, which I think, there's a lot of bad players in the industry.
Yeah.
And so people have had negative experiences. And I want to make everyone comfortable knowing that that's not going to happen here. That's not what Hanley's about. There's again, places that won't allow you to tour. And it's like, our doors, it's like, come in.
Right.
I can't wait.
See what we're
Let's meet some people and chat with who is going to be, your clinical director. Let's see what you're walking into. And you can reach your admission specialist almost any time.
And then your team is actually part of the multidisciplinary team.
Oh yeah.
So that from a healthcare model, right? That's unheard of.
Yeah.
So every day when there is multidisciplinary team with the therapists and the doctors and the nurses and there's someone from admissions there as well. So that to me is just an incredible model.
Oh, absolutely. Because especially in the cases that, the patient's coming in and it's been months. You can't put all of that in a chart, right?
Right.
It's almost impossible to document months of conversations properly. So absolutely, to be a part of the multidisciplinary team and to be able to be there and listen to their treatment planning and, why they're hesitant to do aftercare or why this is coming up. We want to be able to paint the entire picture again, for the clinicians treating that individual.
Yes.
Yeah.
So we're coming up on that time of year that I always think of as, is that normal? Is that normal?
Oh, yeah.
Yes. So many of those conversations. Uncle Bill, drank so much at Thanksgiving dinner that, he passed out on the couch. Is that normal?
Yeah, we get that.
How do you answer the is that normal calls?
Of course. Big picture, which I'm glad you mentioned that because we have a lot of kids coming home from college.
Yes.
We have a lot of family members traveling to their elderly parents. All of a sudden there's pills everywhere and that's even harder, right? Because it's like a doctor gave it. Is that normal?
Right.
Is this okay? She's falling asleep at lunch.
Yes,
and
she is sucking on a pain lollipop all day.
Yeah, and is
normal?
convinced that this, exactly. Yes. And so I encourage people to have those conversations and coming from a place of love, right? Because you can't bully someone or make someone feel worse and get them into treatment, right? Yes. I promise you, they already feel terrible, whether they're expressing that or not.
What you see on these shows, I won't name the shows, but the shows that try to get people into treatment.
The screaming and belittling. And
yes. Nope. That is not what to do.
Nope. And we only work with healthcare professionals who view that, they're some of the most successful in the country.
That's right.
Because of that, because you can sustain that, and families trust that in the long run.
The love.
Coming from,
you come from a place of love.
Yes.
Love first.
Absolutely. Yeah, 100%. So being able to be a part of that initial conversation, and again, the admissions team, including myself, we're happy to have those conversations. We can spend 30 minutes guiding you on having that conversation, suggesting a book, not written by Hanley. We're not making money off of this, but here's a really great book by some really great professionals who have talked families through an intervention. There may not be the resources for an intervention or the ability to get people from all over the country for whatever reason. So what that looks like, and we want to, again, give those resources to everyone, regardless of, what they can afford. But yeah, having those conversations, honest conversation with family members in a loving manner, just saying, we're here if you ever want to talk about it. And we have resources available if you ever want to engage in this.
I love that. And I love that message to family members, because I know people are going to be listening who are family members or who have loved ones that are struggling, and they're saying, what is this normal? And they're saying, what the heck do I do about it? And that message that I hear from you is the shaming and the blaming and the yelling and the things we might see, it isn't necessary. Not only is it not necessary, but it's actually counterproductive.
Sure. And there's also, too, speaking to like the older adults and medications and whatnot, we have more often than not, they're, an alcoholic or an addict, but we've treated patients who are truly just chemically dependent, right? They have, by all intents and purposes, followed the direction of a medical professional or, advice. And
accidental addicts.
They
That's what
find
we call them.
Exactly. They find themselves in this predicament. We can treat that as well. So there are, and sometimes they come around and it's like a white light of, oh, I am an addict. Maybe I did drink heavily and then the pills came into play or something like that. But sometimes it is a true chemical dependency that we can safely help them with. Yeah.
This is so good. Megan, you are just amazing.
Thank you.
And your team is amazing.
Yeah.
I mean, they're just passionate and want to be there and want to help.
It is, because, and I always, I try to keep it when we can lighthearted, because it's heavy work. It's, I am not blind to the fact that we have tried to work with families before and may have lost that loved one before they got the opportunity to come to us. And that still, makes me tear up, because you're so close.
Yeah.
And that's hard for people. I mean, you say, don't take that home. How do you not take that home? You've been talking to this mom, dad, brother, sister for months, and all they've ever wanted was to get their loved one into care. And it doesn't work out. And that's heartbreaking. So my team is, I know that they all feel that, right? Like that's an internal, as clinician, like you guys know that feeling of like empathy maybe, or understanding. My team has that. And that's what I look for in team members, certainly. Someone who really gets the importance of every conversation.
How do you, when thinking about that, so the therapist, right? So I have clinical supervision, and I have ways of dealing with when it because there will be times if you have that passion, like even now you talk about tearing up now, you have that passion, it's going to impact you. You don't want to become a person that's going to ever.
Just like,
but it's also a weight. And how do you, thinking about other professionals who are out there, thinking about people who do this work, how do you hold those spaces? What are the things that you do to care for yourself and to keep yourself healthy and also to help hold your team in that?
For me personally, I don't know how non-addicts and alcoholics do it. I don't know what y'all are doing. But I go to meetings, and I sponsor young women because
Who like Botox?
Who love Botox.
Yes. That's
We have a standing appointment. It's part of the step work.
Perfect.
I kid.
The 13th step, Botox.
Exactly. But it's so important for me to keep that balance, because the bad stories or the heartbreaking moments can be so weighted. Yeah. But the success stories, and they're out there, they can equally make me tear up, right? When someone comes back and, we have a member of our team now who's a therapist on the women's unit, and I could cry thinking about it, because I remember the calls. Oh, she's in the parking lot. She's back again. It's like, I mean, you just want to wring her neck. But, you know, it was like we kept showing up for her and her family. And then to be able to have her as not only like a true rock star in this community, helping other women. I mean, it gives me chills. So they're out there. The good stories are equally out there. And that's the balance for me. And then my own certain the 12-step recovery.
That's 3 like huge things.
Yeah.
Like remembering the good at meetings and that's sharing with other people and but then service. You talked about sponsors. So that's 3 really important ways. Yeah. I love that. Thank you.
Of course.
I just want to say that I find you to be really inspiring.
Yeah,
and I think
me too.
that other staff do as well. I think it's because you're so real. And I just want to commend that leadership.
Thank you.
You're amazing.
Thank you. I appreciate it.
So then as we start to wrap up, and you know I feel that way as well. I mean, I wonder if we'd like to give you the last moments to think about what you would say, and I'd like to ask you to talk to 3 people.
Okay.
I'd like to ask you to talk to the person who's suffering from addiction out there. And what's one thing that you would want to say? I'd ask for what's one thing you would want to say to people who are family members. And then what's one thing that you would want to say to anyone of your choice? So what's something that you would want the person suffering from addiction active right now, what would you want them to hear from you?
You can get the power of choice back, because at this time in addiction, there's no power of choice, right? The disease owns you. There is life on the other side. If my story did not include a pink cloud, as they say, right? I was not, biking around Delray Beach, just happy to be alive. I was like, this is the worst. I mean, who signed me up for this? But I knew enough that going back was even worse. And, some people may disagree with me, but you can go back to drinking anytime if you really want to. No one's kicking it off the planet. You have a choice, though, and you don't have to live like this anymore.
And that life beyond your wildest dreams takes a little bit to get there, but
Just
when you
hang
get
on,
there,
man. Just hang on. It's
so
if you're at
good.
90 days thinking, why don't I have, the house and the cars and, I'm just so happy to be getting out of bed. It's okay if you're not happy to be getting out of bed. Talk about it. Outside issues, get help for those. Go to 12-step meetings, talk to your sponsor, seek spiritual guidance, whatever those things, get outside, go for a walk, hit the beach, just hang on. Like, I still tell myself to this day, when I have a bad day of any kind, this will look different in the morning.
Yeah.
And without fail, it looks different in the morning.
Yeah.
And that's beautiful.
I love that. What would you want to say to family members? What's something you would want them to hear?
Actually, I had this conversation with a dad very recently, and it's not it's not your son. Your son is not making these. You're talking to addiction. You are talking, and it's so hard, right? You, especially as a parent, right? You have carried this child from day one. Through many years that were so positive, right? And then to see what addiction does to somebody and the visceral words they will say to protect their disease, not out of true hatred, that it's not your loved one. It's not. And to also seek support of your own, because the work is not just with, patient Johnny, right? There's a lot of self-work to do as well.
Man. I couldn't have said it better. I love it.
What was that movie, the horror movie, where the monster talked through the kid? Remember that? That's all right. Jeez, oh man.
Rachel's on her own.
The Exorcist?
Yes, The Exorcist.
Oh my God.
That's like the addiction.
Yes.
The addiction
Okay.
is
I
like
wasn't
the-
sure where you were going with it.
I wasn't either. But yes.
That's
I
what
love
addiction
that.
is
Yes.
like. The Exorcist.
It is.
Great
It's
picture.
completely.
What a
Yes.
great picture.
It is.
Yeah.
It is. And it's, yes.
That's how I always think
Yeah.
about addiction.
Yeah.
That that's not the person anymore.
It's not.
But they'll be back
Yeah.
if you can get them help.
Yep.
Your loved one will be back.
Yes, 100%.
We're going to laugh about The Exorcist
That's
now
right.
for a
From
long
now on.
time.
We'll get a T-shirt.
Did you see that look John gave me? What?
Well,
What
here
are
we-
you
I was
saying?
like, I don't know this monster movie, John, do you?
Well, and on that note, the last word is yours. What is one last thing you would like to say?
To say is, it's similar to the first, is just hang in there, baby, Take the advice of those, you might not even like that person, but they may have gone through something just as you are going to go through something to help other people. I remember a really tough time, maybe a few years sober, maybe less. I was like, I was the victim. And I told my sponsor after a meeting, I was like, why is all this happening to me? It's too much. Like, what have I done? It was very like, why is the world doing this to me? It was probably something minute, like they hemmed my pants wrong at the tailor. I was like, why, God, And she said, you're going through this because you can help another woman through this one day. And I, at the time, was like, I don't help people. I don't know which is kind of ironic now in the business.
Sure, because that's all you do.
All I
now is
do.
help.
All I do. Well, she knew more than me. And thankfully, I listened. So
So good.
Thank you so much.
Love you.
For being here.
thanks
So
for
good.
having me, you guys.
So
I
good.
appreciate it.
Exorcist.
I'm never going to forget it now.
And on that note, Dr. D, thank you.
You're welcome. Always glad to be the comic relief.
Indeed.
And we hope that everybody had a good time, and we'll talk to you next time on the Hanley Effect.
Sounds good.
Thank you for joining us for the Hanley Effect. To learn more about our programs, visit hanleyfoundation.org or call 844-502-4673.